My name is Kumba Suun Mboob. I am a Gambian by nationality. I work at the main referral hospital in the Gambia, that is the Edward Francis Small Teaching Hospital in Banjul. And I was recommended to do this course by our able HOD through the office of the First Lady of the Republic of the Gambia. Oncology is still lacking in my country. It's still not developed like other developing countries or developed countries, I can say. We still have a lot of challenges in terms of personnel. In my country, we still don't have a qualified trained oncologist. We have only one medical doctor who did a fellowship in medical oncology in India. And then most of the cancer patients are seen by other doctors or pathologists, I can say. In rural areas, there is no oncology care given to patients. Most patients are being referred to the cities like Banjul or Kanifing, where they see doctors, and then any doctor can see them, but not trained or qualified oncologists. To my knowledge, I don't think we have any qualified oncologists in my country. I suggest my country to have a big cancer treatment center in which we can have, I would suggest we have a well-sophisticated molecular laboratory with a lot of modern equipment like to do immunohistochemistry, where a lot of cancer biomarkers can be detected, and then to have a good treatment pattern like radiotherapy and chemotherapy. In my country, we do chemotherapy, but then radiotherapy is not done as a treatment pattern for cancer patients. So I would suggest that we have a cancer treatment center where we will have a sophisticated molecular lab and then a good treatment pattern for cancer. I would suggest like doctors, nurses, and lab personnel and other healthcare workers to be trained more on oncology so that we will have the large number of people that will give treatment to the high number of cancer patients being seen in my country, because cancer is not a disease that is going down, because we have a lot of new cancer patients coming up, especially breast cancer. I think this training has already done much for me. The training is very, very important to me, because I have learned new and modern diagnosis pattern as a laboratory scientist. I have learned a lot of things that I know if I go back to my country with the help of our institution, we can develop we can do much in terms of diagnosis. In terms of diagnosis to cancer patients, like I have been trained on molecular procedures such as karyotyping, immunohistochemistry, which are really one of the things that are very much important in diagnosing cancer. And then as a lab scientist, I think this training is very, very much important to me, and then I think I can give back to my country if I go back with the help of the management in terms of buying equipment, and so we can do a lot. Yes, I expected to learn new skills in laboratory medicine, and then I think my expectations have been met, because I can say the purpose of coming here, it's almost done, and then I have learned a lot in the pathology lab, where cancer samples or samples that are collected from certain organs are sent, and then biopsy are done there. So I think I have learned a lot in the pathology lab, yes. And then at the microbiology lab, we have seen how samples from this cancer unit or cancer department are being processed, and then which were some are new diagnosis method or patterns I have seen, and I think the expectations are really good, and then I can say my expectations are met. Yes, like I said, I've been exposed to the pathology lab, and then I've been exposed to the microbiology lab, where we visited the molecular lab, which is the key laboratory in terms of cancer diagnosis. And then I've been exposed to the biochemistry lab, and then some of the major places in the institution that are related to oncology, and so we have been exposed, and then things have been explained to us, and then we've understand a lot. this training will really help us in giving back to the patients, because the knowledge gained here, I'm sure when we go back to our countries and then to our various laboratories, we will improve patient care. We will, I think we will, things that we have learned here in India or in Krishna Institute of Medical Science, we will go and see where things are lacking, and then we will see how best we can change the system or then bring in new things that we have learned, and then I'm sure with the help of our institutions, we can bring a lot of changes back to our country. I will advise people, especially from my country, to apply for the courses that the Merck Foundation is offering, because all these courses are important in our various fields, especially those doing laboratory. I will advise more people to be aware of the Merck Foundation and then apply for the courses that they are offering, because it's really a great initiative, and then you can learn a lot of things through the Merck Foundations that are not currently available in my country. So I will advise them to take up the challenges and then come for their studies if they have the chance. Yes, like I said, they can be benefited from the various skills that we are not doing in my country. Like I said, there are certain laboratory diagnoses that are not currently available in the Gambia. So coming to India through the Merck Foundation will help you to be exposed to modern diagnostics methods that are not currently in the Gambia. So students have to take the training seriously and then focus, and then I'm sure they will really benefit themselves and then to their countries or communities. I would like to thank the Merck Foundation through the CEO and all the support staffs of the Merck Foundation for facilitating our travel to India. It was really a great experience. Like I said, a lot of things have been learned, and then the coordination was good. We did not have a lot of challenges coming here, and then during our stay in India, we also don't have anything that will bring down our safety or make us scared or any other thing. Like, we were safe in India, and then I can say all was thanks to Merck Foundation for the good coordination. And then lastly, I will say a big thank you to the First Lady of my country, to her foundation, that is the Fatmata Barbaro Foundation, her entire team rather, and then the Ministry of Health of the Gambia, and then my hospital, Edward Francis Moss Teaching Hospital, the HOD of Laboratory Medicine.